Mr Nadhim Zahawi.
Thank you very much, Madam Deputy Speaker. I welcome today's debate on a matter that is rightly of significant public interest. It is slightly disappointing to hear the Right Honourable Gentleman opposite being found out by the member for East Surrey for really not understanding how viruses spread. If we are going to live with this virus, there will be variants. And he's been asked over and over again, what would you do? And he has been found failing, unfortunately. Throughout this pandemic, this government has taken all the steps necessary to protect the public and help prevent the spread of the virus. Well, we shall see, because as of today, from a sedentary position, the Right Honourable Gentleman says this is absolute nonsense. As of today, I will share with him that 30 million plus people have now got 2 doses. We are at 72 million doses in the United Kingdom, and we aim in the next 4 weeks to offer double dose to 2/3 of all adults. That is delivery, my friend. Sometimes this means making difficult decisions, but not that the party opposite understands these things, such as the Prime Minister's announcement yesterday of the decision, informed by the data, to pause to move to step 4 of the roadmap. We are clear, Madam Deputy Speaker, that the public expects a clear message that these decisions are based on the science. Public health has always been our #1 priority, and we will not risk throwing away our hard-won achievements through the vaccination programme, which have only been possible through the work of the British people. Being led by the data and the science has also informed our approach at the border. This government has put in place some of the most stringent COVID border measures in the world. Each of the measures we have put in place, informed by the latest scientific advice, adds layers of protection against importing the virus, including reducing the risk of importing new variants.
I'm very grateful, Madam Deputy Speaker. Can I just praise the work that my right honourable friend is doing? It's been an incredible journey to vaccinate this nation, and his leadership and the team that he's put together has done a massive job. We all know the way to get out of this dilemma is to vaccinate, and I pay tribute to what he's done. We've spoken much about the Indian variant. Could he just take a second or two to talk about a new variant which is coming on the horizon, the Echo variant, which has been created in Nepal? Thank you.
I'm grateful to my right honourable friend's questions. Absolutely right. We have to remain vigilant. We are part of the reason why the decision was made to place countries like Portugal on the red list, unfortunately, is because we're seeing further mutations from the Indian variant to the variant that it first spotted in Nepal, and hence why we have invested so heavily in our genome sequencing capability and capacity in the United Kingdom. In many instances, we are able to identify variants before those countries and those travellers from those countries actually identify them. But I think the really important point to land, Madam Deputy Speaker, is that no single measure can remove that risk entirely. This is where I think the real division between the two sides is in this House. But each layer we have introduced helps to reduce the risk and protect the hard-won progress that we have seen, including for our world-leading vaccine programme. I want to just set out for the House some of these measures. They include our clear risk assessment of the risk posed from overseas as set out in the traffic light system, our approach upstream at the border, including the vital work carried out by Border Force staff, our robust in-country measures around enforcement and managed quarantine, and the world-leading scientific expertise informing our entire approach. The traffic light system categories and essentially categorises countries based on the risk to protect public health and the vaccine rollout from variants of COVID. The Joint Biosecurity Centre, the JBC, produces risk assessments of countries and territories. Decisions on red, amber or green list assignment and associated border measures are taken by ministers who take into account the JBC risk assessment alongside wider public health factors. The JBC's risk assessment, Madam Deputy Speaker, includes a number of critical factors. the general epidemiological situation in a country, and the presence of prevalence of known variants of concern or new variants, as my right honourable friend has just pointed out. Genomic surveillance capability is critical to the second issue, and the reality is that many countries cannot match the UK's world-leading capability in this field. We've been open about this approach, and indeed a summary of the JBC's methodology has been published on gov.uk alongside the key data that supports ministers' decisions. The rules are firm but fair for passengers arriving in the UK. Red country arrivals must quarantine in a managed quarantine facility for 10 days and take tests on day 2 and day 8. Amber country arrivals must self-isolate in their own accommodation and have a test booked for day 2 and day 8. Green country arrivals, no quarantine required, but must have a test on or before day 2 arrival. All passengers, Madam Deputy Speaker, from red, amber and green countries must have a negative pre-departure test. In the interest of continuing to protect public health, the public are advised against leisure travel to countries categorised as amber and red. Now, on upstream, the success of our travel system relies on everyone playing their part. Carriers have a key role here and are also under a legal obligation, Madam Deputy Speaker, to check each passenger has proof of a negative test. They are liable for a fine of up to £2,000 for not complying. The Civil Aviation Authority has issued 630 fines since the 1st of February to airlines carrying passengers without the right documentation. International arrivals from red countries are required to arrive at designated ports. The Border Force works tirelessly to check all passengers coming into the country. It is continuing to ensure that it has the right level of resources to carry out its duties, maintaining border security and public health, whilst trying to minimise wait times at the borders at all times. To put this into context, Madam Deputy Speaker, we currently have the highest level of staffing since the 2012 Olympics. We have been taking steps to significantly improve and speed up processes at the border by digitising a number of checks, including the passenger locator form, so it can be used at e-gates. These automated checks, Madam Deputy Speaker, happen behind the scenes, meaning people may not be asked to show their passenger locator form to a Border Force officer, but that does not mean that the checks are not happening. However, we have been clear with the public and industry that queues and wait times will be longer if passengers have not completed the necessary requirements to enter the United Kingdom. Our border measures are backed by a robust enforcement regime. As of the 8th of June of this year, Madam Deputy Speaker, there have been 328,860 amber quarantine compliance visits to date by a service run by the Home Office, as well as over 600 fines for breach of home isolation. The Home Office run a service to check that amber arrivals are in fact quarantining at home or other appropriate locations. We've also taken strong steps where travel from certain countries poses a particularly acute risk to the United Kingdom. On the 15th of February, we introduced a managed quarantine facility for those arriving from red list countries. This list is under regular review, and we have taken the decision to add countries to the red list to help prevent the spread of variants of concern to the United Kingdom. All international arrivals from red list countries are expected to quarantine in a government-approved hotel for 10 days. Before flying, they need to pre-book their hotel and testing package for day 2 and day 8 tests on a government booking system. They are also not allowed to use the test to release scheme for early release from quarantine. These measures are kept under constant review, Madam Speaker, including the important impact on individuals with family ties in other countries. I'm proud that we are... Of course I'll give it.
Thank him for giving way. He's outlined the protections that are taken. It's been very impressive, the work that's taken place. Could you just explain a little bit more about some of the separation arrangements in airports themselves? There's points of transit where people are coming together.
I'm grateful to my honourable friend. He's absolutely right. As of the 1st of June, Heathrow has now introduced a red list country terminal, and of course all airports and ports have a responsibility to make sure that passengers arrive and separated safely when entering those ports. I'm proud, Madam Deputy, that we are also protected by our world-leading genomic sequencing capability, including testing those positives that are discovered on entry, which allows us to analyse the test results of arrivals, to identify any new variants of concern as quickly as possible. It not only helps us at home protect ourselves, but helps the rest of the world too. It is this world-renowned sequencing capability that informs the traffic light system, allowing us to take swift, informed decisions to protect public health, something we have not shied away from doing, even when in the most difficult of circumstances. Recognising the strong strategic rationale and success of the vaccine programme, Madam Speaker, we have commenced work to consider the role of vaccinations in shaping a different set of health and testing measures for inbound travel. Individuals in England who have had a full vaccine course will be able to demonstrate their vaccine status through the COVID-19 vaccine certification for outbound international travel, while border health measures at destination countries will be set by obviously the receiving country. These requirements will be set out for the public to check entry requirements before travelling. Madam Deputy Speaker, in closing, this government understands the importance of international travel to the UK public and the success of the United Kingdom itself. We are determined to ensure that the United Kingdom restarts international travel in a safe and considered way, or when the science tells us the time is right to do so. Of course I'll give way.
I'm very grateful to the Minister for giving way. I know he talks about international travel going forward. It's obviously important for the government to be as open as possible. Will he give a commitment from the dispatch box that the risk assessments on India that were published by the Joint Biodiversity Centre will now be published by the government?
I'm grateful to the honourable gentleman. He continues to hark back. Let me give him some detail. So on the 23rd of April, India was added to the red list. On the 29th of April, that is 7 days later, that variant became a variant of interest, not a variant of concern. At that very point, the Secretary of State for Health actually insisted that we take further measures because of his concern, and it was on the 7th of May that that particular variant became a variant of concern. So this government will not take any lectures from the benches opposite. This government understands the importance of international travel to the UK public and the success of the UK itself. We are determined to ensure that the UK restarts international travel in a safe and considered way when the science tells us the time is right to do so. And I repeat that message because it is an important one to land. The Global Travel Task Force, led by the Department for Transport and reporting to the Prime Minister, is working across government and industry to do just that, Madam Deputy Speaker. We have made enormous progress this year in tackling the pandemic across our country. That progress has been hard won in Northern Ireland, in Wales, in Scotland and in England, and it is vital that we do not risk undermining it now. This government will continue to work tirelessly to ensure that our response, including on international travel, continues to meet the challenges that COVID brings us. I commend this debate.